have issue actually the lower back, having severe pain. It's a pain shooting all the way down to my foot, and it's really making my life miserable.
How long has that been going on so far?
Well, it's been going on since this pain began, like I believe so 7 years ago. And I went to see one of the spine doctor. He injects some steroids. He told me like 50% might help, might not. And after that, if that won't help you, then you need a surgery. So I was Googling, looking around, and I was just looking also on Facebook, and I saw you actually. I went deeper and deeper through all the videos, and I was just like, I definitely gotta go come over there and see you. So I'm here today to see what can we do about it and how can we resolve this problem.
You got it. Let's get rolling. So, here's the deal, okay? I want to take a much more closer look what's going on in that region over there, okay? Because evidently, you got sciatica going straight all the way down to your foot, okay? That's what this nerve is all about, okay? This nerve goes all the way straight down, and right now something is obstructing on it. That's what you're feeling over here. It's supposed to be nice and strong flowing, and yet decreased flow. Got it? So that's what you're feeling. All that sensation going on over there. So now here's the deal, okay? What I see over here, bottom line, this one normal is supposed to look like nice and straight.
Okay.
Does that look straight to you?
No.
Not even close, right?
Not even close, yeah.
This fell over here, the fifth lumbar. Okay. This bone on you is supposed to be centered. It is significant towards the left.
Okay.
And what I see over here, not only has it went backwards, okay, it also tilted inwards as such. Okay.
Yeah.
So therefore, see this? This is stable.
Okay.
We're supposed to have this normal movement. But some kind of trauma you experience, you see how much abnormal movement there is? There is way too much motion in this fellow.
Yeah.
Very unstable.
Okay.
So that's why I wouldn't be surprised you feel a lot of muscle spasms in your back over here. It's a defensive mechanism trying to stabilize this thing, okay?
Okay.
Now, it only reduces about roughly, let's say about a third or so,
Okay.
but it's still relatively unstable. So, that's the deal, champ. We gotta reland that fella back in his place. Get you a happy camper. How do you like the sound of that, huh?
Great.
Let's roll.
Let's do it.
That's just not a happy nerve. Right there. Okay, so we already identified there's a lot of swelling over here. More so on the left side versus the right side. Feel that bump right there? If I push that forward, tender?
Yeah.
I'm just doing it very light, and it's already letting you up there. Okay.
Right.
So that's that fifth lumbar right there. Not too bad? Yeah, I know.
Just right there.
Bingo. Okay. That was easy enough. We already identified. That's where we're gonna fix.
Okay.
Just relax. Just breathe. Just breathe. Fill me in. What's different?
It allows me to actually move my leg right now.
You can move your leg, huh?
Yeah.
I understand it was a big shock.
Yeah. Oof. Before I couldn't move my leg.
Mm-hmm.
Wow. Unbelievable.
Okay. Stand up. Let's have you walk around.
Wow. What a difference.
Walk up and down. Once more, open down.
It's unfreeze me.
Again?
I say unfreeze me. It's like I was frozen before. Wow. Unbelievable. Before I couldn't walk at all. It was just like limping around. Wow. And now it actually even my body pushing me towards more to step on it. Before I could just like this to get to the pond. Where have you been 7 years ago?
I've always been here.
I didn't know, God.
Where have you been?
My goodness, I can't believe it. Doctor wants to suggest me for surgery for these things. Wow. What a shocking. Thank you.
Oh, you're very welcome.
Thank you. Wow.
What other changes are you noticing right now?
When I step, actually, I don't feel that nerve shooting me down. Before, when I was stepping, the nerve was like constantly like shooting down, and I couldn't just stay in that position all my weight, throwing it on my left leg. Now I can definitely, totally be in this leg right now.
Okay. Now bear in mind, okay, this is not an on and off switch. Even though it feels like one, okay, your body needs to heal.
Okay.
I want to be clear on this. So here's the deal, okay? This structure right here, okay, that's the nucleus pulposus. This fella acts like a ball bearing. And these rings you see all over here, okay, these are annulus fibrosus. It acts like a containment dam to keep this liquid ball bearing in place. Now there's 25 of these fellas. Okay. Now due to trauma you experience, especially like today, okay, I would not be surprised you breached all 25 of them. Yeah, exactly.
Wow.
So here's the deal, okay? Just like having a cut, okay, what does your body do? Doesn't it like form a clot, seals it up, right?
Yeah.
Your body I'm sorry, your body needs to do the very same thing with this over here as well, okay? So what we did was we corrected your structure by pushing it forward instead of backwards as such, okay? We pushed it forward, back in proper alignment, and we push majority of it in place. Now I want to let you know, there's still some residual of this nucleus pulposus still remaining outwards, okay? Now your body, what's going to do is, it's not going to try to plug up all 25 of these layers. This is not overnight. Okay? Now even though you may feel a lot of big difference right now, okay, a huge improvement, your body needs to plug these holes up. So in other words, no crazy activities. I don't want to see you clubbing and do like merengue or anything like that.
No.
Okay?
No.
Exactly. It takes 2 to 4 weeks for your body to plug up every single one of these breaches. All right?
Okay.
So here's what I want you to do, okay? Still, you have to take care of it. Ice it for 20 minutes, 3 times a day. Okay? Try not to sit too much on it. That's how you aggravate it.
Yes, that's
All right?
exactly what.
And also, don't bend forward, okay? And don't try to rotate left and right. It doesn't like that either. Okay? Any other questions?
Nope.
Okay, so we'll see you on a follow-up visit.
Thank you very much. Thank you.
You're welcome.
My gosh, you're my miracle doctor. Thank you.
You're welcome.
All right, thank you.